main thing that happens when there's some kind of impact or some kind of hit to that brain, when the skull and the brain matter kind of jostles, it changes all the physiological changes, we have biochemical changes, and when that happens, the main thing is that the brain and the eyes, that connection is disrupted. And because vision has such a huge factor on how we gather the information and then how the body experiences that information, it can cause a wide spread of symptoms, including balance, including dizziness or nausea or headaches. And that's what most people miss when they think about concussion.
Dr. Chow, thanks for coming on the podcast.
Thank you for having me, Dr. Miller.
I want to know what percentage of people that have experienced concussion experience issues with their visual system?
Well, here's the thing. A lot of people don't understand and don't realize that after a concussion, they have visual symptoms. And so the way they report it is, oh, I have headaches. I can't stand properly. I'm dizzy. I am having all these symptoms, and they don't really relate that to vision. So when we talk about it like this, in that kind of perspective, a lot of people kind of say, you know what, I didn't even know that I had visual issues from a concussion. But what I would say in terms of percentage is that most people after a concussion, they have either subtle symptoms, if it's not diagnosed as a big concussion, and they still have these visual symptoms.
What would you say causes that? Like when a concussion, the impact occurs, what causes what you're just speaking of?
Well, the main thing that happens when there's some kind of impact or some kind of hit to that brain, when the skull and the brain matter kind of jostles, it changes all the physiological changes, we have biochemical changes, and when that happens, the main thing is that the brain and the eyes, that connection is disrupted. And when that connection is disrupted, that's when all the way the vision is being processed gets disrupted. And because vision has such a huge factor on how we gather the information and then how the body experiences that information, it can cause a wide spread of symptoms, including balance, including dizziness or nausea or headaches. And that's what most people miss when they think about concussion.
How would you begin to go about helping someone that's experiencing what you just described?
So the first thing is when they come in, myself as a neuro-optometrist, I work at the intersection of brain and vision. And so my passion specifically is looking at people who have who are recovering from a concussion and have persistent vision problems. Now, a lot of times people don't really understand what these challenges are and that it relates to vision. And so when they come in, we do a comprehensive neurovisual assessment. And that's what most neuro-optometrists would do. They will take a look at your whole history just to see what are the symptoms that you're actually feeling, and then look at how we can connect that with the visual system. And that's through very specific baseline vision testing, and also known as binocular vision dysfunction testing.
I see. And so the first thing is to check that out. Is it possible to do that online?
Online, we can do a certain extent visually. I mean, there's a lot of visual systems that we can say, okay, if you hold up like a pencil, for example, and bring it close to your eyes, oh, at what point do you feel uncomfortable? And when you feel uncomfortable, okay, stop there. Let's get a ruler out and let's measure that, you know. And so that's one way of saying, okay, that's your baseline. And then what happens if you bring it closer? Do you start experiencing double? Are you starting to feel nauseous? And that's another measurement. And so there are certain measurements that you can do online to kind of get the understanding. And then of course, there's some that require specific lenses for us to see how that person reacts to the lens. and how we can further assess and treat them.
And so let's just say hypothetically someone came in and you were able to do the first step. Hypothetically, what would be the next step for an imagined patient?
So I see patients every day when I go into work, and the main thing is we do several parts, but the first part is like what I said, baseline visual field testing and baseline visual system testing. And so we look at all the different types of visual skills. And what I want people to understand is that when we are doing something, multitasking, or even just looking at one point, and you know this already, Dr. Mueller, we're activating different parts of the brain. And depending on what we're doing, and don't forget you're also standing, or you might be moving around, that's activating a lot more visual spatial orientation. So when we activate all these, those are the systems that we're looking at. How does the brain process that information with that system? So first part is, okay, visual system, the focusing system, the convergence system. So that's part one, gathering all that information. And then part two is when people come in. Usually we split the exams. There's a lot of information there. And the second part is, what can I do to help you with your symptoms immediately? And that's where the neuro-optometry side comes in even more in play. And we look at, okay, what kind of therapeutic lenses can I help recalibrate and have you kind of stand still and feel much more grounded? And those are specific therapeutic lenses that we try. And we do a lot of performance testing as well.
I would love to know about visual processing. What do you feel? Do you feel that visual processing is something that we can increase? Like we all can increase how fast we process visual information?
When we understand how the brain and how the vision works, we understand a little bit more on how we can help our recovery. Now, let's say it's not recovery and we're talking about performance now, okay? We're working the same visual systems. And what we know about neuroplasticity is that we can actually change how the brain processes information or how the brain activates. And so when we understand that the more you do something over and over again, that repetition, the more it fires certain parts of the brain and then form new neural networks. And so when I relate that to vision and performance and visual processing, what I tell patients is that when we look at something, we don't want to have that lag. Oh, it's blurry. Oh, focus. Oh, get the lens to focus so that we can keep still, keep fixation, and then refocus at a different distance. And so what I tell people is we can absolutely retrain the brain by, especially the visual processing areas, by the idea of neuroplasticity. And so the more you do something, the easier it is. Because with vision, we want it to be, you look at a different distance and immediately you want to be able to focus and keep it clear and fixate on that target.
I hear a lot of times, and I was so curious, was people tell me after they've had a concussion, they have eye floaters. And I know this probably is it's not a complex topic, but I just want to know, like, what you think may be causing eye floaters after a concussion.
Actually, this is a very good ocular health topic when it comes to this, because as we know, with concussion, it's like a mild brain injury, and a lot of times it can come from a physical like hit or impact to the brain, and other times it could be just a little bit of a movement. But the idea behind it is that floaters inside the eyes, we have a jelly substance. It's called a vitreous. And that jelly substance is made out of 99% water and some proteins. So that structure is for nutrients. But what happens is that over time, because it's a liquid, it's a fluid, it starts to shrink. And that's where the protein particles, the floaters, float around. Now, then you have someone who had a head impact, let's say it's a physical one. That's going to jostle the head, and it's going to impact the eyes. And that's when people will start noticing, oh, I'm seeing more of these floaters, these flies moving around. They're basically the protein particles floating around, and even more after an impact. And that's why, to add with this, if people start noticing a lot of floaters all of a sudden, or some flashes of light with these accompanying these floaters, that's something that I want the audience to understand that, okay, I'm seeing flashes of light now. I need to go see an optometrist, an eye doctor, just to see what's going on in the back of the eyes. Because the floaters can pull on the back of the retina and cause a retinal tear or a retinal hole. And the symptoms for that is all of a sudden, people start seeing dark, kind of like a curtain coming down. And that's not something lightly to be ignored. So make sure to see an optometrist if that happens.
Or have you ever heard of eye yoga by chance?
There's different ways of when people say eye yoga. It's like when people say face yoga, right? It's different terms. I would assume, I haven't specifically heard someone say eye yoga, but what I would say is that it's the same as, okay, what can I do to kind of stretch out the eyes and have more mobility in terms of oculomotor movements, which is eye movements. And that's what I would assume. What's your thoughts on that, Dr. Miller?
I think it's an interesting concept because I like to talk about brain yoga, which should be like basically like trying to stretch out your brain and create new connections. So I like the concept, but I wanted to hear, somebody who's a neuro-optometrist, what they thought of that. And is there any like practical tips you could give people to start to improve their vision?
So to come back to the eye yoga, everyone understands what yoga is, it's stretching the body. And when you talk about brain yoga, we can apply that concept. And so that's why people probably termed it eye yoga, because it makes sense overall. And so at the end of the day, I wanted to include that after the therapeutic lens part of the exam and the ocular health part of the exam, the next one of the main treatments would be vision rehabilitation and vision therapy. And so since we're talking about eye yoga, another way of saying it is, okay, what can we do to retrain and rebuild that brain and eye connection? And so a lot of times the patients will step into an individualized program where we would say, okay, let's start with specific eye exercises just to recalibrate so that you can start stepping up the ladders to recovery. Now, as you know, with recovery, everyone is different. Everyone's symptoms are different. They experience different things. During the first part of the assessment, if I have someone bring their finger close to them and I see that the whole body is moving back, I can already kind of sense their symptoms because I can see it in their facial expression that they're very uncomfortable. So depending on the severity and the symptoms of that patient, that's when I would say, okay, let's start very basic first. And some of the basics would be, okay, I'm going to close one eye. I'm going to take out a target, in this case, my finger, and I'm just going to look at my finger. Keep it clear. Make sure I'm able to fixate on my finger. And that's step one. How easy is that? But some people, bringing their fingers too close for too long is uncomfortable. And then afterwards, I would say, okay, now focus, keep your finger clear, and now move it side to side. And so as you see, for someone who did not have to go through a concussion, something like that is very simple. But for those, depending on severity, that can elicit nausea, dizziness immediately. So some of the exercises I would say, or would be doing each eye, tracking your fingers first. Those are the very basic first. Do the other eye, track the fingers, and up and down. And again, some people just up and down, they feel like their whole body is gonna lean back and fall off. So sit down doing this.
What role does blood flow like play in recovery for people?
Well, when we talk about blood flow and the amount of blood coming into the brain after a concussion and all that inflammation that happens with the brain, let's putting that aside and also thinking about how much energy the brain is exerting to heal itself. And so when we add those components together, the brain is using a lot of energy to try to navigate the world again. Specifically, how, in my case, with vision, specifically, what is being input to the system, the brain, the system, the computer, okay, and how that processes information.
How, with like more severe cases, how do you help people stay optimistic and help them see and make progress, like especially with vision?
I see a lot of the more severe cases and patients experiencing a lot of symptoms. And I want them to understand that everything that I test when I'm doing visual assessments, we can improve. It may take time, it depends on the person, and that I want people to understand that recovery is not a linear process, and that even though you may not feel that progress immediately, you're still having progress. And so these are things I like to remind patients of, because a lot of times when they start working on all these different types of visual activities and exercises, we reevaluate after 3 months. And it does take, in terms of neuroplasticity, we want these patients to work on these exercises like 20 minutes a day, for example, every day, or at least 5 days a week to activate that neuroplasticity. And so I want people to kind of really understand that, just because you're not experiencing the improvement immediately does not mean that you're not improving, and that we are working with your threshold. And if you are pushing, we want you to understand where your threshold, where your boundary, where your limit is. Because once we push past that, and I've had patients where they are so determined and they will push, even when they're not feeling well, to the point where they are so dizzy and all the symptoms come up. And then they are out for 5 days. And I have a lot of patients like this because they're so excited to get back to how they are. And I want to remind these people, these patients, that we don't want to overexert ourselves, just like with anything. We don't want to overdo it because that will rebound us back lots of steps. And to understand that every small win is a win. And so some people, I would say journalists even audio record this. That's today I feel better, and I feel better, and then maybe at 5 o'clock, or actually maybe at noon, I'm not feeling good again. And then as we go, okay, maybe I'm better now. Maybe it's 1 o'clock in the afternoon that I'm starting to feel it. These are little evidence that I would recommend.
I see that too, and I love that. It's all about constant progression, no matter where you are right now. We feel happy when we make progress in life, and I I see the push and pull is like I see a lot of people that are gonna push through the brick wall and like kind of bounce back. But I also see the other side is people kind of are scared to go a little out of that comfort zone because they're so scared of that fallback and that relapse, if you may.
It's the fear and anxiety of getting hurt again or feeling unsafe again. This is why I like to tell my patients this a lot, and it brings them a different perspective because At the end of the day, what's going on is that after an injury, any type of injury, specifically with head injury, we are activated with our sympathetic nervous system. And when we are in that fight or flight state, we don't feel safe. So what that means is that our vision really narrows down to our focal system, which is our central vision, because we need to focus on what we need to focus in order to survive. That's the brain's natural way of saying, I need to feel safe right away. But what happens is that, and people understand this because they heard of the term, oh, stress causes tunnel vision, right? And so I like to explain this to my patients in a way that this is what's going on. You're having that tunnel vision. You're feeling unsafe right now. And so I want to remind them that the bigger picture, what all the multidisciplinary, the whole team is doing, big picture wise, is to bring you back from that tense, uncomfortable sympathetic nervous system state to more of the calm parasympathetic nervous system. And that's the idea behind it. And that's why I talk about meditation, I talk about breath work, because these are all systems and foundations of getting you to get back to that state. And so for those who are fearful or worried about that, I give them that big picture. Let's bring you back into that calm, relaxed state, and so that you can feel safe again. And then we slowly add to it.
I love that. Yeah, I love the holistic idea. The Our body needs to be able to relax. And I was wondering from like a nutrition perspective if you know of like foods that may be good for the eye brain connection.
So a lot of the diet, the food, I talk about in general optometry as well. You know, what keeps the eyes healthy. We'll talk about that and then I'll expand. But in terms of the eyes, we know that we want lutein. Lutein is very good for your central vision. And so lutein is based with green leafy vegetables, spinach, kale, all that is good for the eye health itself. Okay. Fish, that's a big one. You know, fish omega-3s, you know, having that specific amount is very good. The EPA and DHA, because that's not just the eye now. Omega-3s is also for the brain. Brain health is also for the heart. And so that's a big one as well as carotenoids, carrots, all that sweet orange vegetables and fruits is also very good. At the end of the day, when you take a look, and you know this as well, Dr. Miller, absolutely, is when we balance our whole system with all the nutrients, and then we add in sleep, and then we add in hydration, and in a holistic way, in a naturopath way, that's going to help your system.
Yes, you got it. Every little step in the right direction counts. Love to hear your background and how you originally got into neuro-optometry as well.
Absolutely. I'll tell you my why.
Yeah.
Oh my goodness. So I actually did graduated in 2011, and I graduated from the States in Pennsylvania. And what happened was that I was really strongly interested in vision therapy at that time. Advanced pediatrics and vision therapy, not specifically concussion, but in terms of like, okay, what can we do with the eye exercises to increase performance? And that was very interesting. And I remember, I'm Canadian, so I remember saying, okay, after school, I'm going back to Canada and I'm gonna bring it to my community. And and then life happened, and for 10 years I decided to do a general optometry, which is also in itself amazing because that's the whole eye. Over time, after I had two boys, I said, you know what? I want to do more. I want to kind of bring in that passion again. And that's when I made a big decision and I said, do I want to dabble in this or do I want to jump into neuro-optometry? And all the stars aligned because I jumped into from two practices, two optometry practices that I own and manage. I consolidated to one. And then I said, okay, you know what? As much as I love my patients, I'm going to jump all into neuro-optometry. So I had a colleague take care of my patients while I jump into neuro-optometry. The big why happened actually close to pandemic time. And I remember listening to a lecture of an optometrist, and he was treating someone, a 17-year-old hockey boy athlete. He is a hockey player. He got into a really bad concussion and could not walk straight for 2 years. And that video showed how disoriented he was. And then the optometrist, he put on these glasses for him. And immediately, after 2 years, he started walking somewhat straight. And I remember looking at that video and I had goosebumps all over. And I said, what is going on? What kind of glasses did this doctor prescribe? I'm an optometrist. What's going on? And so I got really emotional. And immediately I sent an email to that doctor. And he was pretty much explaining, these are therapeutic lenses, they're prisms. And not that many people can prescribe prisms. Go for it. Yeah. Spend 18 months nonstop just reading all about it. And so to backtrack, after that, after my two boys, then I said, you know what, I'm going to jump all in. And that's where I am today, in a clinic that only does specialty of neuro-optometry. And my first year doing this, I had the opportunity to help a patient in her 60s, 70s, and she came in after a motor vehicle accident. And she was holding onto a walker and walking, and she couldn't do it. It was very uncomfortable. So I had the opportunity to do this now. And after I gave her those therapeutic lenses, she called out for her husband and told him to come into the room and then said, look at this. And she moved away her walker and she power walked out of the room. And I said, oh my gosh, be careful. But that was my turning point. This is my why. This is why I'm doing this.
That's so rewarding when you see somebody go from A to B and you help them in some way to do so, and I love that. When it comes to light, and the different spectrums of light, does that have any impact upon like our visual system and visual processing and eye health or any of that?
A lot of patients, they come in and they're very sensitive to light. Many of them, they need, like the whole office is very dim for them. And they're wearing sunglasses indoors, hats indoors, and the light really affects them symptomatically. And the reason why is because, and I like to explain it like this, after an injury, that light switch on how we process the light comes in. And before, the brain's able to kind of process that light switch, the dimmer, okay? Oh, there's too bright, the environment's too bright, that's okay. I'm able to adjust that and I still feel safe. But what happens is that after an injury, that regulatory system absolutely gets affected. And my belief is that the brain is saying, you know what, that's not as important as this right now. And it's kind of selectively deciding, what do I need to focus on first? And so other things is not as deemed as important for the brain. And what happens is that people start noticing that it's not just light. I'm expanding now. It's not just light, but people, even people around them, that environment is too stimulating. So the brain is being selective now. And the fact that all the other external noise that's coming in, it will filter in what I need to know at that moment in time. It's all the visual processing. Which one am I going to focus on first at that moment? And so what we do in the office is we will try on different tints. And these tints either reduce the amount of wavelengths coming in, or they block certain wavelengths. For example, those bright screens, the fluorescent lights, or the lights coming out from your screen, we drastically reduce it. And again, this is all performance testing. It's not, oh, this lens will help with this. It's more, I'm going to show you a tint, and I want you to feel your body. Do you feel immediately more tense? And there is one lens now, FL41. It's an orangey tint that a lot of people after concussion feel, oh, I feel much better with. And so there's my system of doing that. But again, when we talk about therapeutic lenses or tints or any of that, I like to prescribe through performance testing.
What would you personally say? Like, what are some of the dogmatic things, as like a whole, someone who views health from a holistic lens? What are some dogmatic things about people and just the overall field of, neuro-optometry and, you know, what are some things that you wish would change about how people saw eye-brain connection?
I'm so glad you asked me this question. When people come in, a lot of the times they say, how come I've never heard about neuro-optometry? Or that, you know, people didn't really focus and say, oh, we need to see a neuro-optometrist if you're having these symptoms. And this is my whole mission here. This is my why, because the impact that I felt after my why, my story, I said, why I need to, my mission is to extend this out to the world, to the public, because I don't want to be their last option. A lot of people, they come in and they say, you're my last option. I've been to so many places and I don't know what to do next. And I've been experiencing this, and many of the doctors have said, you know what, this is just how it's going to be, or over time you'll feel better, or that essentially they would say, don't worry about it, it is how it is, and here is the reality of things. Like, the more we learn about the brain, the more we can apply specific concepts to, for example, neuroplasticity, and the more we can actually do something about how we process our visual, how we process the world around us. And so, in terms of what I would like is for people to understand this concept and to understand the big picture around it, because I see the evidence every day when I'm at work. Um, Patients are feeling better. I've seen people who have, initially when they come in, they are kind of like hiding themselves, like the whole body, you can see how uncomfortable they are. They're not walking straight. They just feel very cautious about everything, the whole environment, about how to keep feeling safe. And over time, as we work on these visual systems, we can see the whole personality changing, the mood, the behavior, how their posture is, how they present themselves. All that is very evident because we see these patients all the time as we do the vision therapy and the follow-ups. And they're a totally different person, but the big picture is they're not different. They're how they truly are. They're back to how they feel again, how they are, and even better once they understand how to work these visual systems.
That's very powerful. I totally agree. When unfortunately, a lot of traditional medical doctors they're not educated on the importance of the things that they say to the patient because they're the authority figure, and they look people look up to them. And when you say something that eliminates hope for people, it can be very detrimental. But on a side note, I wanted to know, I just my own curiosity. I went from reading 200, Jim Quick. I used his reading course, and I went from 200 words per minute to like 600 words per minute. And I was wondering what happened in my brain. He helped me do that in like 21 days. How is that possible? Like that, I went from 200 words to 600.
Dr. Miller, this is very fascinating. So I have met Jim Quick at a conference, and that was the first time I met him, the first time I understood his story and what he does. That was shortly, actually just last year. I have to admit, I haven't fully read his book, and I don't know specifically how he structures his program. It's funny because I started reading and I'm at page 10. But what I can say in terms of reading and all that, when it comes down to reading and vision, you bring up something close. Let's say you bring up your phone or you're bringing up a book, and there's several systems happening in play. You have to be able to fixate on that sentence. You're going to have to keep still and keep a focus. So we have fixation skills, we have focusing skills, and then now we have to smoothly track from from the left to the right, let's say, and keep that focus clear, and then now jump to the next. And when you're jumping, are you accurately jumping to the next sentence, or did you skip a couple lines? Okay, so these are the things I want people to kind of understand. Okay, so now that we have these skills, we're talking about 5 skills already, okay? And that's just holding up something to read. I mean, what happens if you are lying down or if you're standing up? That's different. That's even more systems in play. But what happens is that when you're doing that, is the words moving? Is the words clear? Is it jumping? Is it doubling up? That's where 2020 vision does not mean processing, because you can see the words 2020 very clearly, but how you process that information, if it's all mumbo jumbo, jumping up and down, that's a different story. So in relation to reading with vision and processing, all those systems, you want it to be like this, very easy, because then when your visual system is at its highest maximum potential, then it's so much easier for the brain to exert the energy on understanding what you're reading now. If your brain has to work on how to use your visual system to read, then the brain is not going to comprehend what you're reading. And so I talk about this a lot because I see a lot of vision, learning related vision problems at work as well. And so in terms of how to process the information quickly, even though I don't understand, I don't know the whole process of how Jim Quick does it, what I can say is that once you have the visual systems at maximum potential and you're going through it, your brain is exerting a lot, the energy now in understanding keywords to comprehend what you're learning. And you're probably being able to have that focus, the attention, and the endurance, the cognitive endurance to keep focus.
That's super cool. Thank you for sharing that.
It's super cool.
It really is. It's endlessly fascinating. Just like a few more questions I had for you. If you could talk about, there are different kinds of vision. That more than just 2020. Most people think vision is just about, how 2020, 2030, 2040. But there's more kinds of vision, if I'm not mistaken.
Eyesight, people would say 2020, what's your visual acuity? How well can you see things? And yes, our norm is 2020 vision. Okay, that's clear focused vision 20 feet away for that specific letter size. Now, what happens is that I want people to understand that even though you're seeing the 2020 line and everyone says, you know what, you're fine, your health is good, the ocular health is good, your vision, your eyesight is good, how come I still feel this way? How come I still feel off? Like something is off with my eyes. How come I can't focus that clearly? Or that my attention span is not quite there when I'm looking at things. And that kind of relates to brain fog as well. Okay, but that's what I'm saying when people say that, oh, you're seeing perfectly well, you're fine. But the thing is, seeing something does not mean that you're processing the information. So that's one way. The second is more vision, and I like to focus on vision, or another term is sight. Okay, um, vision and sight synonymous, but essentially it's saying how does the brain and the eyes process the information together? And once they team together, how can the brain process that visual information to its most efficient maximum potential to optimize its efficiency? In other words, how can we get the brain is the computer and the eyes is the operating system, and now we add it all together. It's kind of like your speed for your computer. How can you process that information quickly? So that's how I like to explain it. And then of course there's side vision, peripheral vision. And then there's also contrast sensitivity, meaning, oh, I can see it, but it's a little bit, there's all these shades to it. It's not, that contrast is not bold enough. And then of course there's also night driving, and that relates to contrast as well. Oh, I thought I'm seeing 2020. How come it doesn't seem that clear when I'm driving at night? Lots of factors involved with that.
It's fascinating.
So I want people to understand this because it's like vision, eyesight. It's not just 2020. 2020 is one part of your vision, and then you have all your other visual skills together to form your whole system together for the brain to process the information.
Fascinating. Thank you for sharing. And how can people reach out to you? How can they find you, and where can they find you?
Absolutely. Currently, I have two channels. The main channel at this moment is called I am known as the Sight Doctor. So anyone who kind of wants to learn about how we can improve our visual performance to its highest potentials. For example, those who are on the screen all day, what can we do to help process that? I use what I learned from concussion, from that lens point to drive the system to relate to how we can improve our visual potential for high performers, for athletes, for those who have that need that cognitive endurance. And so that handle is, you can find me on Instagram at Dr. Lisa Chow. More specifically, I branched out the Sight Doctor to concussion because that's also my passion. And
Awesome. Thank you for sharing. And what would you like your impact to be? What is the impact you would like to make upon the world?
my biggest mission right now is to be able to impact millions and millions, for people to really understand that the brain and the eyes, that visual connection, can be essentially, that visual processing can be related to a lot of things in your life, whether it's performance, whether it's how you feel when you're seeing things, and also on recovery. So performance as well as recovery, and that vision plays a huge part in it. And I want people to understand that.
Thank you for coming on.
Thank you, Dr. Miller, for having me.